Jim, there's been so much rumour and speculation, so let's start with what we know for sure. Kim Jong-un hasn't been seen in public since April 11th. Where's he been?
Well, I don't know, and that's what the world wants to know. Now, is that a possible indication that he has poor health? Yes, but we have to underline that we played this game before with him and with previous leaders, where we've said, oh, he's disappeared for 2 weeks, he's disappeared for 3 weeks. You know, does that mean he might die? Similarly, with the supreme leader in Iran, there have been numerous rumors about imminent demise that never came true. But whether he's in trouble or not, in some ways, this gives us, and it gives the world community and the policy community, a chance to think, what happens if this is true? Because if it were to be true, maybe it's not, maybe it happens a month from now, maybe it happens 6 months from now. But given the conditions, we haven't been talking about what that means for North Korea and for the region. And so it gives us a chance to say, oh my gosh, maybe we ought to think about this.
Jim, I understand that Kim Jong-un has also disappeared from public view before. Back in 2014, he was absent from the public eye for 40 days, so this isn't unprecedented. Why such fierce speculation now? Was it as fierce the last time round?
Well, first of all, it's a cottage industry, you know, so, and how could you not speculate? I mean, it's natural for people and people in the media to do that. But obviously, there are some other things going on. You know, I'm not a doctor. His physical appearance does not suggest, you know, a healthy lifestyle. Let's just be honest. And then in addition, you know, it's a pandemic, right? In North Korea, where does North Korea live? Right next to the country where the coronavirus originated. Now, North Korea has denied that it has any cases. I find that hard to believe. I'm not saying he would have contracted it. Obviously, Boris Johnson did. So, you know, do we have a smoking gun here that something is awry? No. Should we expect that something will happen tomorrow? Probably not. But again, I want to emphasize, because of the focus on COVID-19, which is totally appropriate, and all the things that means, we haven't been thinking about North Korea. But if North Korea, if the leader dies, in a context in which there's a global pandemic, it's under sanctions and entering a recession as China's economy declines, that's a big deal. And we might want to think about that before it happens rather than after it happens.
Sure. Jim, we've talked now a little bit about Kim Jong-un's health. So let me ask you, what is the state of North Korea's health system? What sort of treatment could Kim Jong-un expect in country?
Well, I think it's mixed. Obviously, he's going to get the best health care of anyone in that country, bar none. And, you know, there are, as you referenced, reports that Chinese doctors have made their way. But the healthcare system in general is not very good in terms of public health. And so, you know, there are a lot of unknowns here, and we don't know what coronavirus is doing in North Korea. But if it did manage to enter, that public health system is not prepared to deal with that. And I've had reports from the ground that suggest that because the North Koreans are essentially shutting everything down, there really aren't a lot of international doctors, international medical aid workers in North Korea to help with that. And so, you know, there are, 15 Europeans, another dozen UN officials, not a lot of folks to help the North Koreans deal with this. So, you know, whether it's his own health problems, maybe he has no health problems at all. But I think this bears watching, because it could lead to economic and social instability in a country that doesn't have nuclear weapons and feels like we're threatening them. So maybe we should pay attention to that.
And we absolutely will continue paying attention to that. Jim Walsh, a senior research associate from MIT. Thank you for joining us on Al Jazeera.